The majority of the wounds that people have will manage to heal on their own or with simple treatments such as wound closure and that sort of thing that you receive in an acute care setting. However, in a wound care center such as this, it creates a whole new environment when one's dealing with a wound that hasn't healed over some time. There must be some sort of barrier to wound healing that would keep this wound from healing, and those are the sort of things that we're able to address in this wound care center. Well, our center was designed to manage patients with a large variety of types of wounds. Patients have to have chronic wounds, not meaning that they have to be in existence for some weeks prior to coming to our wound care center. And chronic wounds are very common in diabetic patients. They have a lack of sensation very often that makes them get injured in ways that the rest of us wouldn't. If you have numbness to your feet, you can injure yourself with simply getting blisters and not realize that it's happened. Those of us who have normal sensation won't get these kind of injuries because we'll feel the pain and we'll try to deal with it to avoid the injury. But patients with neuropathy, as it's called, or bad nerves that are not functioning well due to the diabetes can get these kind of wounds. They'll then progress also to not heal because of the diabetes. Diabetes has a variety of problems with the blood vessels as well as metabolic problems that interfere with the healing process. And this is very much one of the things that we're dedicated to try to treat in this wound care center. Among my various educational background is that I have a PhD in nutritional biochemistry and metabolism, where I attended Massachusetts Institute of Technology. I strongly include nutrition as one of the factors that must be corrected in order to get wounds to heal. If one does not have the building blocks for wound healing, it is impossible to heal a wound. It is much like trying to build a house without blocks and mortar. You just can't do it. And so nutrition has to be dealt with in all of our patients who have any problems in eating, obtaining foods, or perhaps just they need education. It's something that we routinely assess as an impediment to wound healing. Very often we have to work with the family physician and try to educate the patient themselves on how to eat better. In some cases it's simple as taking a multivitamin or vitamin C. In other cases it's much more complex, taking in enough protein and calories to be able to heal a wound.